So I guess today I'm going to speak on astigmatic connections with the OCULUS Pentacam instrument and the LENSAR laser. As an overview for my talk today, I'll first quantify astigmatism and potentially why we are not correcting as much astigmatism with cataract surgery as we should. Then I will look at some of the unique abilities of the Pentacam and how it interfaces with the LENSAR laser. And then I will show you my outcomes and answer any questions. So in tackling astigmatism, we know that astigmatism is prevalent. Yet 70 to 90% of patients have treatable astigmatism and it remains uncorrected. So the elephant in the room is why we're almost 1.4 million diopters of astigmatism left uncorrected last year. And there are some reasons for that. First of all, we want to be able to give patients consistent outcomes. Just like any consumer that purchases anything, they want value for their dollar. And if we can't deliver consistent outcomes, then maybe we're not so confident in our treatments. Also, we want an instrument that measures the accuracy, the magnitude accurately. And we also want precise measurement of where the axis of astigmatism is. So it's not just the magnitude, but it's also the axis. And once we measure and define the astigmatism that we want to treat, we want to be able to take that information and apply it accurately to the eye. So the information has to be transferable. And so OCULUS Pentacam has combined with Streamlined 4 software with the LENSAR laser system to guide astigmatic treatments. The OCULUS Pentacam is a phenomenal instrument. I've been using this instrument since, I believe, 2004, 2005 for my refractive surgery patients for LASIK. And it just, I can't say enough about the usefulness of this machine in my practice. It uses a slit beam to illuminate thin slices of the anterior portion of the eye, and then the Schleimflug camera will rotate 360 degrees around the and provide several cross-sectional images of the anterior segment. So these individual images are used to reconstruct a three-dimensional model of the anterior segment, and a second camera actually accommodates for patient eye movement. The result is a detailed analysis of the anterior cornea, also the posterior cornea, and the crystalline lens and anterior chamber. All of the images that the Pentacam takes go through the central cornea, and we are capable of covering the anterior surface of the eye from limbus to limbus. So there are several measurements that are extremely useful with this device. The total corneal refractive power is important not just for cataract refractive patients, but I have also found it extremely useful in treating patients who've had LASIK, cataract surgery with post-LASIK as well. And we can see higher order aberrations, spherical aberrations, and also measurement of the angle kappa, which is important for SMILE if you're doing corneal procedures, and important also with cataract refractive if you're putting in a multifocal IOL. OCULUS does have a preoperative guide available, which can detail this information for you further. So this is a very typical image of regular astigmatism. It's quite beautiful and colorful. And the nice thing about the way the image is presented is you can instantly see the symmetry here. You can see the perfect symmetry between the total corneal refractive power and the axial, the sagittal curvature of the front. You can see the corneal thickness map and also an elevation map of the front of the eye. So you would be very confident in treating this patient with toric IOL. If you were going to treat them with a LASIK procedure, depending on the level of myopia, this patient has very regular astigmatism and will be very successful. And you can easily see that from the image here. This is a patient of mine who has irregular astigmatism. And we can see that the image here has symmetry as well in analyzing the data that's presented. So with a quick look in your clinic, and that's fairly important because when you have a diagnostic instrument and you have a lot of patients that you're seeing, you want something that you're going to be able to look at and give you a quick read of what's going on. And when you look at how the information is presented with this instrument, you can see very well what's going on here immediately. The interesting thing about this particular patient is with this device you can see that centrally the astigmatism is pretty regular. You have the inferior steepening, 5 diopters of cylinder, but 47 straight across against the rule, and 41 to 42.5 with the rule. So I actually did put a toric lens in this patient, a toric lens that corrected 4 diopters of astigmatism, and they're Plano 2020. So this particular image gave me the confidence to use that technology, even though it's not necessarily on label. And then, of course, we also have patients that present with corneas that look like this. And we can see here, because of the presentation of such irregularity here, and the total corneal refractive power varying almost 10 diopters in just 45 degrees, that this patient is not an ideal candidate for a refractive surgical procedure, and in fact is post-RK. So your surgical planning is going to be much more of a basic procedure for this patient, but perhaps your surgical counseling is going to be a lot more advanced in explaining to the patient what's going on. Patients can easily look at this and know that that's not normal, especially when you tell them it's supposed to look smooth and symmetric, and they see this, and even the most basic person without much experience can look at that and know there's something not right about it. So in using this instrument to guide astigmatic corrections with Streamlined 4, it gets very exciting. And I was very excited when Pentacam was able to couple with this laser, because I've been using this laser, and it was initially coupled with the Cassini. And so I had been performing treatments with, because I also have the Cassini, I've been performing treatments with the Cassini and getting really great results. Because when any of these devices are used with the LENSAR laser, we get iris registration. We get information that's able to perform an iris registration maneuver. And then the laser will actually make marks on the steep axis. They'll make them in the cornea, or now they'll actually make them in the capsule. The software also has an enhanced toric IOL selector and adjusts for surgically induced astigmatism. So, can we start? Oh, can you start the video? So this is me on a racetrack for the first time, and my instructor is next to me, and he's trying to tell me how I'm supposed to drive around the racetrack. And one of the things that he said to me, which was very interesting, is he said, if you want to drive fast, you need a fast car, but you also need to put your foot on the gas pedal. And so in putting your foot on the gas pedal with Streamlined 4, part of that involves using your devices to perform iris registration. And so we can see here that was six degrees of rotation for this patient. So if I were marking with a pen, I could easily be off by 6 degrees. And we know when you place your toric intraocular lens, if you're off by more than 4 degrees, you're really not going to be very effective with that IOL. So the marks can be seen in retroillumination when you're operating, and for the purposes of this video, I marked those areas with my pen. So I was seeing them in retroillumination. I wasn't sure it was going to come off too well in the video that you would be able to see it. And then when you insert the IOL, you just simply rotate it underneath the marks. The new software for LENSAR will actually place those marks on the capsule. So you will not have to worry about the parallax in focusing from the cornea down to the marks on the IOL. And this really makes things very, very simple. So you have your beautiful data from the Pentacam, which you've been learning about with many of the other lectures, and you take that information and you directly wirelessly put it into the LENSAR laser, and it guides your operative treatment, and patients get great results. Here's a video of how we do the astigmatic treatments. So you'll see this is a large astigmatic treatment, only a few degrees shifted, but still it's very important if you want to get the best results for patients. So the information enables us to adjust for cyclorotation and get great results with our surgery. So what happens when we do that? We know what the typical result is for patients who get manual astigmatic treatments. They've been published. They're not bad. 70-some% of patients getting vision where they're not wearing glasses. And with toric IOLs, people are getting in the 80% when they are marking the patient with their pen. But what are we getting with OCULUS and Streamlined? Well, again, I mentioned earlier that I did most of my work with Cassini in the initial stages, and now I'm doing work with the Pentacam and looking at choosing which instrument is going to do a better job, okay, in registering this information and giving me good outcomes. And you'll all be happy to hear that there's no significant difference between these instruments. So, you know, before we had the integration with the Pentacam, you know, Cassini had great data and a lot of people showing their integration. Well, and the study's not finished. We can see here I'm only up to 7 eyes here and 13 eyes here. But initially LENSAR did the statistical data with this, and there's no difference. This instrument is as good as anything out there, and it is an excellent device. So these are my results for astigmatic incisions. I'm a girl that does a lot of astigmatic incisions. I had started with 279 eyes for the 2-week data and the 3-month data, and now I'm out 1 year. And so we can see that preoperatively all patients had greater than a half a diopter, because this is the preoperative bar right here. And postoperatively, at 1 year, 91% of my patients have less than a half a diopter of refractive astigmatism left. So you don't always need a toric lens. This is my astigmatic data, 279 eyes, average of about a diopter, 3 months, about 1/10 of a diopter of astigmatism. But these are my toric lenses. So I only have 73 eyes for my toric lenses because I treat a lot more astigmatism with toric. I'll go up to about 1.8 or so with my astigmatic incisions and flip over to toric lenses at about 2 diopters with the rule, about a diopter 0.5, 0.75 against the rule. So still, with iris registration and utilizing Streamlined 4 with your toric IOLs, you will get excellent results. And again, the OCULUS Pentacam is equivalent, as good as any device. And this is a non-cumulative frequency distribution of those 73 eyes, and we can see postoperatively, here's where a majority of them are. 93% a half a diopter or less of refractive astigmatism out post-surgery. So the astigmatism connection is really cyclical, because you start with a great topographer that can give you accurate data and help you with your preoperative planning. And then you have the automation, which helps to reduce variables and decrease waste so that you have a repeatable process. And when you have a repeatable process, you're going to get great results, because you can continue to look at those results and provide feedback to improve your topography and your preoperative planning and how you automate.